Hello everyone, Angelo here for this episode of #AskYourDerm. So for this episode, we're going to be talking about a really important topic. So it's all about knowing where to get the proper advice about skincare sa internet. So as we all know, yung internet guys is so full of information about skincare na parang minsan, it becomes a bit confusing which ones we should follow. Now, the thing about the skincare community is it's comprised of different skin wellness advocates. Now, ano nga ba yung mga skin wellness advocates? These are people who are knowledgeable about skincare. And each one has their specific role when it comes to giving out skincare advice, depending on if they're actually a certified professional or not. And speaking of certified professional, I have here a board-certified dermatologist. We have Dr. Claude Javier. Hi, Doc Claude. So, ano nga ba ang mga goals natin for this #AskYourDerm episode?
Hi, John. So, our goal for this episode of #AskYourDerm is to first know their credibility, know which information you can get, and also know which one you consult.
Alright, so just to give a quick rundown, there are different kinds of skin wellness advocates. Gaya nga ng sabi natin kanina, all of them differ in the degree of their knowledge on skin health and skincare. So yung mga skin wellness advocates, these are as follows. So first one, we have the general practitioners. So these skin advocates are able to identify common skin-related problems kasi trained talaga sila to be doctors. However, in extreme cases, they usually refer to board-certified dermatologists who actually specialize in skin. Pero guys, meron pa rin silang credibility as an expert because they've been trained as doctors, gaya nga ng sabi ko kanina, but a better understanding and assessment of skin-related issues can be received from board-certified dermatologists. Next up, we have estheticians. So, despite not being trained to the level ng mga doctors or board-certified derms, these skin wellness advocates are able to administer yung mga treatments and properly apply products sa skin natin. So some of them are directly working under the supervision of dermatologists where a lot of their knowledge and experience in skin health comes from. And then third, meron naman tayong cosmetic chemists and formulators. So cosmetic chemists and formulators know the process of manufacturing skincare formulas para yung active ingredients na nasa skincare are properly delivered into our skin. And especially from a formulation standpoint, they are very credible sources of information since most board-certified dermatologists work together with them so they can prescribe and administer what these skin advocates or these cosmetic chemists formulate. Next up, we have skincare content creators. That is yours truly. So, skincare content creators are basically skincare enthusiasts. So, we're not expertly trained nor certified, but what we can bring to the table is our experience sa paggamit ng products and our knowledge of the brand. So, we can recommend these according to the different preferences of people. Like, for example, yung mga budget. And we're also updated on the new products that are released. And we're also updated if okay ba sila or hindi. But of course, that is from our perspective. So skincare content creators, we have to be responsible in getting our information. We have to make sure na yung information na nakukuha namin is from credible and expert sources. And one of the best sources is our last skin wellness advocate. We have board-certified dermatologists. So sa mga hindi alam, si Doc Claude Javier is a board-certified dermatologist. So board-certified dermatologists are specifically trained to treat skin conditions. Therefore, when it comes to skin health, sila talaga yung mga, sila na yung mga dapat nyong puntahan talaga to address these skin conditions. And when there's something na parang nagbabother sa'yo about your skin, they're really the ones you should approach. So board-certified derms have had formal training for years and are specialized to handle both medical and surgical aspects of things that concern the skin, the hair, the nails, and other skin problems. Kaya nga, kapag meron kang clinical na concern talaga, it's absolutely a must to consult with a PDS board-certified dermatologist to know the root cause ng problema and what you can do from there. Alright, so Doc Claude, can you help elaborate to us how important the role is of a board-certified dermatologist when it comes to yung sa mga issues on skin, hair, and nails?
Okay. John, you made a very good explanation of all the skincare advocates we have, no? But sometimes, the skin is underestimated. we should not underestimate it, because the skin is actually the largest organ in the body. And most often, it is the skin that mirrors what's going on inside. It is sometimes the first sign of even a more serious health condition. So, the role of a board certified dermatologist is actually to promote, educate healthy skincare habits, and also to advise patients, give them evidence based advice, and also help ameliorate signs and symptoms of their skin, hair, and nails conditions.
I see. So, when it comes to a board-certified dermatologist, Doc, kasi 'di ba meron siyang parang label na board-certified. So, my question is, how does one become a board-certified dermatologist? Like, how long is the journey starting from becoming a doctor?
Okay, alam mo, it's a lot of years, no? It's a lot of years of sacrifice and dedication. So I believe that the board certified dermatologist role is really very important. They should be put in the forefront of all skincare operations, because just to be a doctor, it already takes 9 to 10 years. To be a dermatologist, add another 3 years. It's a lot of steps. Do you wish to know the steps, Jan?
Yes, Doc, we want to know how long it takes para people realize as well how grueling yung training is.
Actually, may pasyente ako, 17 years old, na gusto talaga maging dermatologist. Akala yata niya, madali lang. Nung sinabi ko lahat ng steps, ayaw niya. So anyway, ang first step niyan, after graduating from high school, syempre you have to earn a bachelor's degree. You have to get a pre-med course. So this is around 4 to 5 years. And then the next step is you take and pass the National Medical Admissions Test. This is NMAT. So it's important to get a high score here para it's gonna be easy for you to apply in a medical school. So that's the third step, earning your medical degree. So this will be another 5 years. That includes your clerkship and internship. So after this, you have to pass another test. That is the physician's licensure exam. So after passing this, you could already be called a doctor and given a medical degree. You could practice as a general practitioner and be a family doctor. So you can stop here, but if you wish to subspecialize or to specialize, you have to take residency. So dermatology comes here, and so are the other specialties like pediatrics, OB gynecology, surgery. So this specialization takes another 3 to 5 years. So the Philippine Dermatological Society has 13 accredited training institutions that give this 3-year residency program. So you can find these institutions in our website, the pds.org.ph. And then, after having residency for 3 years, you have to take another exam. And that is the certifying exam or diplomate exam given by the Philippine Board of Dermatology. So, after passing this exam, you are already given an expert tag in that specific field of medicine. So it takes a lot of years.
I see. So, grabe pala, Doc. And also, yung na-notice ko is yung, di ba merong mga nakalagay sa end ng mga names ng doctors like FPDS and meron ding DPDS. So, that's what I realized pala, yung diplomate. So, that's yung, kumbaga parang final. Tama ba, Doc? Is that like the final step?
It does not end there.
Oh my gosh.
Actually, oo. The doctors, they continue to study. They specialized already in dermatology. Then they subspecialize again to pediatric dermatology, dermatopathology, to cosmetic dermatology, aesthetic dermatology, a lot. So they can still subspecialize. So walang tigil na pag-aaral, and parang every year you have to update yourself because it changes every year. There are new things being discovered every year.
I see. Grabe pala talaga. So to our viewers, you can really see yung work that it takes to become a board-certified derm. And kaya alam nyo talaga that this journey is really no joke. It takes a lot of hard work and determination. And so you really know that these board-certified dermatologists are really experts and are really passionate in their field. So, board-certified dermatologists have undergone these steps to ensure medical mastery over our skin, along with the diseases, causes, and treatments tethered to our skin. Now, Doc Lod, meron akong isang question when it comes to consulting naman a board-certified dermatologist. So, a lot of people actually think na mahal mag-consult with a board-certified derm. Do you think this is true, Doc?
Is it expensive ba, John? How much is expensive to you for your health? So, for me kasi, a doctor's primary duty is to provide service to all, regardless of age, gender, race, social status, religion, political belief, and monetary compensation is only secondary. So, I don't think there is much difference in the fees charged by doctors. However, I think the fees that they charge are affected by certain factors like the difficulty of the case or the time they spent treating the patient, the years of experience or how long have they been practicing, their specialty training done here or abroad, or the location of their clinic. Are they practicing in the barrio or in the city? But the most important for me is knowing your patient's capacity to pay. In which case, pag wala talaga, walang maibabayad, ini-waive na lang natin yung professional fee. We do that. So, in this time of pandemic, the Philippine Dermatological Society actually is offering free teledermatology consultations in 13 PDS accredited institutions. And meron pa ha, marami. A total of actually 15, if I'm not mistaken. You can find these institutions at our website, pds.org.ph, and also in our Facebook page.
Ayan. So, thank you for that, Doc. And actually, it's so insightful that you said na a lot of people actually don't know that board-certified derms offer free teledermatology services via PDS-accredited institutions. And also, what I realized is, I think, sabi mo, Doc, yung it's more what you consider expensive for your health. And I really think that there's so much truth in that kasi a lot of people, they tend to experiment, they tend to DIY on their skin, and in the long run, mas lumalala lang yung skin condition nila, and the worse it gets, ayun nga sabi mo, Doc, the more expensive the treatment could be. So actually, delaying the treatment could actually make it more expensive.
True, Jan. It's not cost-effective.
Okay, so sa mga viewers natin ngayon, again, remember, consulting with a board-certified dermatologist is free through PDS-accredited institutions. Just check out their website. Alright, so Doc Claude, I have another question. So, is it enough to ask, our family doctors or general physicians about yung mga skin-related issues natin, like diseases or conditions, or just information on skin health in general? Like, where do we draw the line between visiting a general physician, like a family doctor, versus consulting with a board-certified dermatologist?
Okay. John, I really would like all of us to work harmoniously with each other. So, we are all doctors here, and we all know basic knowledge of all diseases. Specialized or not, we should all work together in harmony and mutual respect. So we should also be compassionate and dedicated to provide competent medical care to all our patients. I can say that I am a family doctor to a lot of my friends and relatives, but I know when to refer to a specialist, especially if it's a serious condition or a difficult case. So you can see here, expertise and experience is very important to catch a serious condition early and also to prevent complications. So that is also what I would like to tell my colleagues. We can treat, we can give advice to our relatives and friends, but when it's something more that requires more analysis or more an expert management is needed, then we should learn to refer.
Ayan. So, thank you for that, Doc Claude. Ang ganda talaga ng sinabi ni Doc Claude for those who are viewing this episode right now. When it comes to experts, it's not really about pitting them against each other kasi maraming mga tao kina-compare nila yung mga experts, which one is better over the other. When in fact, what we should really be doing is to allow these experts to collaborate and to, provide us the best healthcare that is possible because we deserve it at the end of the day.
Okay, Jan. Pwede ba ako naman ang magtanong sa'yo?
Sure, Doc.
How do we become more responsible in researching skincare information on the internet?
I see. Thank you for that question, Doc. I think it's very, very important, especially for non-experts, non-certified people like me, to let people know kung paano ba talaga mag-research ng tamang information that comes from you guys, from the board-certified derms. So, ako, what I personally do is, the first thing is, I get to know what my issue is with my skin, and the best person to do that is actually really a board-certified dermatologist. So, after consulting with a board-certified dermatologist, they're able to, properly diagnose what issue it is na nagaganap sa skin ko. And then, kapag alam ko na what my issue is, that's when I check and see which skin advocate might be able to help me. So after ko mag-consult kay board-certified derm, for example, sabi ni board-certified derm, maybe you should include a moisturizer into your routine. So that's when I go to skincare content creators to see ano ba yung mga moisturizers that fit my budget, ano nga ba yung mga moisturizers that have a certain ingredient. Like for example, board-certified derm says, get a moisturizer with niacinamide. So it's really knowing what the skin wellness advocate excels in and also when to consult the experts in the field. And then another one is I make sure that the facts I get about skin and skincare, as in yung mga facts talaga, they come from experts like such as you, Doc Claude, yung board-certified derms, cosmetic formulators. And also, I make sure na yung mga sources na tinitingnan ko, they're cited when there are, for example, mga statements. And this has become very easy because there are some board-certified dermatologists on social media who talk about statements, who talk about facts, and they always back it up with sources. So that's a really amazing thing that's making information more accessible. And also, one thing I've learned as someone who is a non-expert is that while studies, publications are accessible to even non-experts like me on the internet, I feel that it's best to have them really be read and interpreted by actual experts. Kasi na-realize ko na kahit kaya kong basahin siya ng parang in general, I won't be able to interpret data kasi hindi naman ako expert, and that should be left to people who can actually interpret data because it actually also takes training pala to interpret data. And so I've really learned that these are where the experts, board-certified dermatologists, cosmetic formulators, etc., this is when they come in. So, ayun siya, Doc.
Very good. Thank you, John. Buti na lang talagang nagre-research ka din before you blog anything or you post anything. I'm happy. I'm happy that you're keeping the public safe by doing very good research.
Thank you, Doc. That means a lot. Okay, so Doc Lod, since ikaw nagtanong sa akin how I can be more responsible or how I practice responsibility in researching information on the internet. I also wanted to ask you, do you have any tips in yung sa pag-research namin ng skincare information on the internet, lalo na hindi kami expert on this kind of data?
Okay, John, this is very important, especially now na lahat tayo nasa internet, no? Lahat tayo nagsisearch sa internet, ang doctor natin, si Dr. Google na, we should really be very discerning. So, not everything we read in social media is true. Always check if the source is reliable. So, we are also held responsible for whatever we post or share in social media. Diba kaya nga nauuso fake news, fake news. Ayan. Kasi social media can be your friend, but also can be your enemy. It can build, but it can also destroy. It can save lives or it can kill. So let us use the information that we receive wisely and post only factual data. Yung mga public viewers natin, huwag naman kayo magtampo sa doctor nyo if they refuse to answer your queries, your questions in social media. Kasi we are guided by a code of conduct. We are not allowed to dispense any specific diagnosis or treatment in social media. Hindi rin kami pinapayagan mag-endorse ng kahit anong medical, health, or skin product. Kaya usually ang consultation natin very private, diba? You even sign a data privacy notice whenever we get data or pictures. Yan. And before we even get out any information or before we give our advice on skincare, we make sure that what we say or what we write is thoroughly studied, analyzed, and comes from only evidence-based and up-to-date sources. So, trust only your skin experts when there are skin concerns that you have.
Alright, and that is it for this episode of Hashtag Ask Your Derm. Thank you so much to Dr. Claude Javier for this very insightful talk.
Thank you, John, for being here as our guest in Hashtag Ask Your Derm. I appreciate all your insights and all the things that you have shared with our audience. So, everyone, if you have any questions, just type in hashtag Ask Your Derm so we may be able to answer your questions. And also, if you are looking for skin health information and looking for a board-certified dermatologist near your area, kindly visit our website, pds.org.ph. And also, visit our Facebook, Instagram, and Twitter page.
And for those looking for content where we talk about choosing skincare products while also taking into consideration facts as well as the opinions of experts like board-certified derms, do check out my YouTube channel, Angelo, or my TikTok at Ongyel. And I'll see you guys in the next episode of Hashtag Ask Your Derm. Bye!